Okay, and we go to learning schistosomiasis. Another name of schistosomiasis is bilharziasis. Schistosomiasis or bilharziasis is caused by some species of blood trematodes. And these blood trematodes are in genus Schistosoma. The three main species infection humans are Schistosoma hematobium, Schistosoma japonicum, and Schistosoma mansoni. And these three species you must know. And another three species are non-main to learn, but they can cause you must know about them, because you can, as doctors, you can meet them in your patients. Okay, life cycle. Let's go to life cycle. Life cycle is not hard, not so hard. Sometimes it's more simple that of another flux. And what about life cycle? Schistosoma eggs. There are three main schistosomas, are eliminated with feces and urine, or feces and or urine. It is depend from species. Under appropriate conditions, the eggs hatch and release myriacidia, which swim and penetrate specific snail intermediate hosts. This worms has only one intermediate host. Inside these freshwater snails, produced sporocysts, many daughter sporocysts, and these sporocysts form a lot of free swimming cercaria, and these free swimming cercaria penetrate the skin of the human host and shed their forked tails, becoming schistosomulae. The schistosomulae migrate via venous circulation to the lungs. After that, they go to the heart and then develop in the liver. Exist in the liver via the portal vein system when mature. Male and female adult worms copulate and reside in the mesenteric venules, the location of which varies by species. Okay, for instance, Schistosoma japonicum is more frequently found in the superior mesenteric veins draining the small intestine, and Schistosoma mansoni occurs more often in the inferior mesenteric veins draining the large intestine. And the last one, Schistosoma hematobium, most often inhabits in the vesicular and pelvic venous plexus of the bladder. But it can also be found in the rectal venules. The females, it is all all of that, all of them. The females of this flux deposit eggs in the small vessels of the portal and perivesical system. The eggs are moved progressively towards the lumen of the intestine. It is the Mansoni japonicum, Mekongi, or Guinensis, I'm sorry, and of the bladder and ureters. It is when we're talking about hematobium, and are eliminated with feces and urine respectively. Okay, what's the next? We must talk about hosts. This life cycle, as you can see, life cycle of these worms are with change. These worms change their hosts, and the main hosts, most important hosts, are dogs, cats, rodents, pigs, and human. And these worms are zoonosis and anthropozoonosis diseases, called diseases. And there has an intermediate hosts, and these three most important worms has specifically intermediate hosts. For Schistosoma mansoni, specific intermediate host is snail, biome Phalaria. For Japonicum, specific hosts, intermediate host, is Oncomelania snail. And last one, Hematobium, has specific intermediate host, and we call it Bulinus. Okay, and if you know these specific intermediate hosts, you can talk about a geographic of these diseases, where we can meet these parasites. For Mansoni, geography, it is a sub-Saharan Africa and South America countries, Brazil, for example. For Japonicum, Chennai, Philippines, and not Japan. And the last one, Hematobium, Africa and Middle East. Okay. What's the next we must learn? It is an clinical diagnosis, clinical presentation. Symptoms of schistosomiasis are not caused by the worms themselves, but by the body's reaction to the eggs. Many infections are asymptomatic, and this is very dangerous. You must remember about that. And as another worms diseases caused by worms, by flux, they have two main stages. First stage, it is invasion, and and this stage has a local cutaneous sensitivity reaction following skin penetration by cercaria. It is small inchy maculopapular lesions, and it is A part. A part, and B part, it is first stage 2. We can see migration of worms inside our organisms, but this first stage are asymptomatic as usual. The second stage, just a second, it is an acute form. Acute form associate with fever, cold, abdominal pain, diarrhea, for example, or hepatosplenomegaly, and eosinophilia. Okay. The next stage. The most danger worms are Schistosoma mansoni and Schistosoma japonicum. Pathology associated with Schistosoma mansoni and Schistosoma japonicum schistosomiasis, and includes various hepatic complications from inflammation and granulomatosis reactions, and occasional embolic egg granulomas in brain or spinal cord. Pathology of Schistosoma hematobium schistosomiasis includes hematuria, scarring, calcification, squamous cell carcinoma, and occasional embolic egg granulomas in brain or spinal cord. And as I said previously, it is very, very dangerous worms. And the last one, I think it is a diagnosis. Diagnosis is simple and hard, but if you know that your patient come in to you from epidemic country, for example from Brazil, or for example from Chennai, and have some specifically eosinophilia, hepatosplenomegaly, you must examine his or her stool and urine, or must examine serologic testing for specifically antibodies for these worms. And when you examine a stool or urine, you can find three in stool, two variants of eggs, and in urine eggs. Okay, what I'm talking. Okay. Schistosoma mansoni has a big eggs with spike on the one of the side of the body. This is the spike. I make it bigger. Okay, and as you can see, eggs of Schistosoma mansoni have a spike here, and there are large eggs without heads, and around 100 for 200 micrometers long. And as I said, you can find it in humans too. Second one, it is an eggs of Schistosoma japonicum. Schistosoma japonicum eggs are smaller than another eggs between another eggs of Shistosomas, and it has around 50 to 60 micrometers, and it has very small spike, and this egg has a circle form, and as I said, you can see that you can find that eggs in a stool of human. And the last one, Schistosoma hematobium's eggs. It is a large too, 100 from 100 to 150 nanometers long, micrometers, long, and it has spike on a terminal side of this egg, and you can find it in urine of human. Okay, how to come back? How to prevent these diseases? There are no vaccine, and you can avoid swimming or wading in fresh water when you are in countries in which schistosomiasis occurs. Don't drink this water from these rivers. Okay, and water used for bathing should be brought to a rolling boil for 1 meter to kill any cercaria, and then cooled before bathing to avoid scalding. Okay, and water held in a straight tank for at least for 2 days should be safe for bathing. Okay, and there is all.